Hola familia, Carlos Vides con Mentes Innovadoras aquí por Televida. Yo espero que ustedes estén pasando un feliz día, una feliz semana y preparándose para las fiestas especiales que nos vienen. Como siempre es muy importante que usted se cuide su salud para que podamos disfrutar todavía. Sabemos que COVID-19 ya dicen que ya no está, pero siempre escucho que andan personas enfermándose. Es importante que usted cuide su sistema de inmunidad, que se proteja para que podamos disfrutar estas fiestas en armonía con nuestras familias y logremos tener mucho éxito. Esta semana prepárese, siéntese y tome notas. Va a ser en inglés la entrevista, pero aún así quiero que usted tome notas porque vamos a hablar de todo lo que tiene que ver con salud y con seguros médicos para personales o para compañías pequeñas. Y tengo dos expertas aquí conmigo este día. So let me tell you who I have here with us today. We're going to be talking about health insurance for small groups and also for a family. So if you're interested in knowing what a health insurance would do for you, especially with all this, situations we have COVID-19 and everything else, we want to make sure that we are protected. Because if your health is good, you will make the money you want to make. That's the way I see it. So with us today, thank you for being here with us.
Thank you for having me.
Yes, I hope you share some good stuff with us.
I hope so too.
Yeah. And from Smart Environmental Services, I have Marie.
Hi.
Marie, thank you for being here and taking your
Thanks
time.
for having me.
A little bit cold, isn't it?
It is.
Yeah.
It's cold today.
I'm interested in knowing what is in Smart Environmental Services and what do you guys do?
Yeah, so we're a local Kansas City small business, and we complete mold, asbestos, lead, water services, and includes demolition.
Wow.
So-
So do you do that yourself?
No. I have a team that does that.
Oh,
But we
right.
have 9 employees, and like I said, we service the entire Kansas City area, and we complete residential and commercial services.
Fantastic.
Yeah.
So what made you get into that type of business?
Yeah, so about 16 years ago, I started at a large insurance company and managed companies that we are today. So I managed all of our Kansas City vendors that did water and mold removal and things like that, and recognized a need in our community that the customer service wasn't there, the knowledge, the expertise. So 3 years ago, I started this business.
Fantastic. So, I always find it fascinating to talk about how you get into this type of
Right.
business.
Right.
And there's always some kind of passion about doing something good for the community.
Yep.
And you do environmental services, and, a lot of these old buildings, they're full of asbestos and leads and different type of paints. And
Right.
so I bet that you're very busy
We are.
fixing those buildings.
We are, yeah. And what we really like to do is help our customers with whatever services they need. But lately we've been walking into houses that are with customers that are very, very ill. People don't recognize that mold is a poison. So whenever they're, not cleaning up some water issues or some leaks, that can be a bigger issue.
That starts at the basements, right?
Yeah, a lot of times, or really anywhere there's a leak in the house. So when that's not cleaned up quickly or professionally, then mold can form. And sometimes we walk into houses where people are very ill. So we're able to help them. That does help their health.
Fantastic. I love this type of stories because, when we look at the older model homes, they don't have the proper foundations and that water it just sits in there.
Right.
You can
Or
smell
the
it.
ventilation too.
The
Sometimes there's not enough
ventilation.
ventilation, yeah.
Well, this goes all along with what we're going to talk about today, health insurance and different ways to protect your company, your employees, and everybody else. Now let's talk to the expert here, Jackie. Jackie, thank you for taking your time and sitting with us here today at Innovative Minds. For me, it's a true honor to have you here because the subject that you're bringing us today, which is health insurance, is a big deal. And for us in the Hispanic community, every little bit of information we can get, it helps us. Because we don't understand very well how the health insurance process works, especially for a small business owner like Marie, with the small companies. There's a lot of mom and pop shops in the community that want to have access to health insurance, but they don't know how to get it or where to start. What do you have for us?
Well, as you mentioned, my name is Jackie. I'm the founder of Indigo Partners. Next year will be my 20th anniversary of being a licensed health insurance agent and benefits specialist. And
Well, you definitely have the experience.
yes, I do.
Yeah.
And the consistent thing I see year over year is the cost. The cost of health, and not only health insurance, but healthcare going up, deductibles going up. So if you're self-employed or own a small business and you want to be able to provide some sort of healthcare or health insurance to your employees, that can be it can be really unaffordable for a small business owner to be able to do that. And what I was seeing year after year is even for the ones that were offering health insurance, and you don't pay the whole premium, the employees were unable to pay their share, especially if they had spouse or children who needed coverage. And so several years ago, I just started researching alternatives for people. And the marketplace expanded and opened up, and that gave opportunity to a lot of people. But the subsidies, there was a bit of an issue with the subsidies where family members weren't getting subsidized. So if the employee had a nice coverage through an employer, but they maybe were in a situation where they would qualify for a subsidy on the marketplace, they were unable to receive that subsidized portion for their spouse or children. Luckily, on October 12th of this year, they passed a bill that will now allow for employees who have a group plan to be offered a subsidy for their spouse or children, which is really going to change the lives of a lot of people who either are paying a lot to have their family covered or maybe don't have their families covered at all.
Well, in many cases, they actually don't have their family covered.
Many cases.
And they are just getting the very minimum in their health insurance because they can't afford it. It's too expensive. I have a restaurant owner client in Gardner, Kansas, and one husband and wife only is $2,500 a month. And how can you afford that?
And a lot of those people are in their 60s, and they're, because the plans are age-based, the older you are, the more expensive the rate is. So what I see consistently are people, 62, 63, wanting to start saving for retirement, but their health insurance costs more than their mortgage.
Wow.
Or their rent, and that doesn't even count the deductible. So if you do have a health condition, or you go to the emergency room, or you need to have surgery, you may have a $6,000, $7,000, $8,000 out-of-pocket expense on top of the thousands of dollars you're paying each year.
And that is actually one of the most common things for people to even say that they have a health insurance to get these high deductibles, right? I have heard that a lot. Being in a community, I hear all these different comments and from people and testimonies about how much money they spend in health insurance, but also how hard it is to get health insurance because of the cost. And in reality, most people don't even get it because they just give up on it.
It's complicated too.
They go through the risk of see what happens. So Indigo benefits is what you call reimagining benefits. Where are you guys at?
Where are we at? Like physically located? Yeah. Oh, we're in the Overland Park area, but we have clients all throughout the Midwest and the South. So
people can contact you over the phone, over the web.
Correct.
Everywhere.
Yes, we have online inquiry, phone, we do video. If depending on the size of the group and location, we go out to groups, we do employee meetings. We have clients in Georgia and Florida. Those we do virtually. Although it's so cold, maybe we need to fly down to Florida and see some clients for the winter. So we can work anywhere in all 50 states, but primarily our clients are right here in the heart of Kansas City and then throughout the Midwest.
Fantastic. Let me give you an example. Let's say, and let's put the expertise to the test here.
Okay. Pop quiz.
Working with the community, especially with the Hispanic community. And let's say I have a client right now, he owns a restaurant, has 11 employees. And he's been asking this question, how can I afford to get some kind of health insurance to my employees? What are some of the benefits or some of the steps this employer can take to hopefully offer something to the employees?
Right. So On average, health insurance premiums rate, they run anywhere from $400 to, like you said, for someone older, $900 or over $1,000.
Correct.
Just for one employee.
Yeah.
So if the employer is willing to contribute toward that, that significantly would help the employee offset some costs. But again, if they have a spouse or children, that may not be affordable. So that's where we came up with our exclusive Indigo plans, where each person has access to telehealth, healthcare advocate, medical bill saver, but they also have access to one of our licensed agents who will help walk them through the marketplace, help them determine how much of a subsidy they may receive. So the employer is offering that resource to their employees, because it can be very overwhelming and confusing to navigate the marketplace by yourself.
It is.
So
and
people go to
Yes.
healthcare.gov. It's a lot of information. And even if you're very savvy, there's a lot of tax rules and things that you need to know or you should know, because you may improperly apply for a subsidy unknowingly. So we have licensed agents who will help each employee navigate that. And you may have some that are on a spouse plan. You may have some employees who are under age 26 and they're still on their parents' plan. That's great. Our goal is that everyone has access to something. And we want to
mention something. I'm sorry, guys.
Go ahead.
Because I know that you enjoy what you do. I can tell. You mentioned at the very beginning something called telehealth. What is that?
Telehealth gives people access to a licensed provider, so a doctor or a mental health provider, over the telephone. We have an app, website, number of ways. It allows people to have quicker response time, to have access to a provider more quickly. And most of the plans, the employee would pay $0 out of pocket. Some it's $15. If you were to walk into urgent care, that would easily be $100 to $200 just to walk in the door, or more, if you need an x-ray or anything. Now, granted, the telehealth isn't going to replace the emergency room, but it is the first line of defense. And I could use an example as a restaurant, a local restaurant franchise. And really, this young woman was really my why, probably 10 years ago, that I started these plans and I started researching these plans and I started using these plans for my own family. So I knew exactly how they were used and the benefit of them before I ever marketed them to other people. But this young woman, she was a single mother, and I was a regular there. I loved their breakfast burritos. I used to go everywhere. But
Who doesn't?
Yeah, I know. And I went there a multiple times, and I was pregnant, so I'm going to blame it on that. I was craving it. But and she had 2 little girls, and she was always at work, always, like without fail, every morning. And I didn't see her for a couple weeks, and I thought, oh, maybe she moved on. She went to another job. And then one day I was there, and she waited on me, and I was like, oh, where have you been? And she had an infection on her leg, a skin infection, and she couldn't afford to go to the doctor, so she didn't go. And the infection got worse and worse and worse until she was very sick and had to go to the emergency room. So I'm guessing, I don't know this for a fact, but I'm guessing she couldn't have afforded the emergency room visit.
Correct.
May have filed medical bankruptcy, which is a huge problem in our
and it's
country.
Actually, in the financial world, we always say that that's one of the biggest factors for bankruptcy.
It is, correct.
And because not having the right health insurance and access to health insurance.
Right.
But not only did she have an emergency room visit, she also missed work for 2 weeks. She's a single mom. Was she able to pay rent? I don't know. And the employer, who didn't offer any benefits, lost out on an excellent employee for 2 weeks. Yeah. So they're struggling to staff for 2 weeks. Yeah. So I thought, this is crazy. We have people showing up, good people showing up every single day, day in and day out, to do their jobs. And something as simple as an infection could keep them from work for weeks. Yeah. And a very expensive hospital bill that probably isn't going to be paid.
Correct.
And I kept thinking, this is crazy, but I know that small businesses, really, most can't afford to cover a significant portion of health insurance, especially as the premiums are skyrocketing.
Yeah.
So that's when I just rolled up my sleeves and I was like, there has to be a better way. And I went through multiple vendors. I signed my own family up for I don't even know how many telehealth programs. and I used every one of them. And I found a vendor. They have, well, pre-COVID, they had almost 3 million members. I'm guessing it's more as telehealth has really expanded since the pandemic. Accessibility. People need the accessibility to a provider, but they also need the affordability. Even if you have health insurance, you have a copay or a deductible to see a doctor, which is something that a lot of people don't have. A lot of people are paycheck to paycheck. So even with health insurance, urgent care could be a week or two of groceries for them.
And I want to ask, because Marie is your guest, and she's going to tell us a little bit about, because you're a small business owner.
Right.
And at Smart Environment Services, you have that service. You told me a little bit about that you have the telehealth services for your employees.
Yeah.
How have you seen that benefit them?
Yeah. So, kind of going back to what Jackie said, when we talk about teledoc or telehealth, one of the benefits of it is that they can call in and do an online visit with a doctor for free. So as an employer, I've really liked the fact that I'm able to give a benefit to our customers that gives a discount. So it's basically a health discount.
Yeah.
Now, again, something like teledoc is great because it's a free service.
Yeah.
And then if, by chance they have that conversation with the doctor and they need an antibiotic, well, they can get that at a very discounted rate too. So that's one of the benefits. There's also discounts for dental, vision, and eye care as well. And I know a lot of our employees have used, especially going in for dental checks, a lot of people wait until they have to get that root canal.
Yeah.
It's really important to go ahead and get those checks early on. I know one of my employees went in and it was over a $3,000 bill and it went down to $1,000. So that's a huge savings.
For somebody, absolutely.
Right. And I'm not saying $1,000 is not a lot of money. It really,
But
really
it's
is.
less than
But
$3,000.
if you didn't have something like that, we were able to give our employees any just this little bit of benefit that helps a lot. Yeah.
Definitely is. And for those of you that are listening, I picture, and as I'm listening to the two ladies, I'm picturing you, the restaurant owner, the roofing company owner, the tree services, the commercial cleaning companies, the painters, the framing companies. All of you can be a perfect example to be part of this type of program, so you can then sign up for yourself, sign up for your employees, and or at least ask the question, how can I get into these programs? And that's what they are here for today, to share with us some valuable information so you can reach out. And Indigo Health is here in Kansas City, the Overland Park. There's local information. And she's also telling me that she may have some Spanish service as well. So let's ask a little bit about it. Do you have somebody that can help us on Spanish?
Yes, every single service available on the Indigo plans is available in both English and Spanish. And when we first joined the Hispanic Chamber, Carlos was sharing some stories with us of people who would maybe be in the hospital with a loved one and there was a language barrier with the providers.
Always, yeah.
And that's very technical terminology. So for someone to trying to navigate the healthcare system is hard enough. And then not being able, having a language barrier. So all of our plans have bilingual options for any service. So mental health, if someone needs to speak with a therapist, that is available in Spanish.
Let's stop right there for a minute. I know you have a lot to tell me about mental health. It's a big deal.
Yes.
And in our community, I've seen it with my very own eyes, how these moms sometimes are searching everywhere for ways to help their kids. And there is nowhere to be found this type of service because most insurance companies don't even offer it. How would that help?
Well, yeah, a mental health benefit or a mental health one appointment could be $100 to $130. The mental health benefit is $0. So the employer would pay the membership fee on behalf of the employee, and the employee would have access to mental health services, counseling for not just the employee, but the spouse and dependent children. There are some regulations about mental health benefits for minors, but there are services certainly for the parent to get help. There's an employee assistance program on most of our plans. I think if not all of them have that built in. And that's something, if they need any sort of resource, that is a 24-hour, pick up the phone, whatever you need assistance with, someone will at least help you navigate. Again, all available in Spanish as well.
And that's the benefit that our company
Nice.
uses. Like I said,
Yeah.
this has been so great through Jackie's company that I pay $40 a month for all my employees, and these are all the benefits they
Who
get.
cannot afford $40 a month
Yeah.
to have access to a
Right.
doctor and in Spanish?
Right.
You know you can do this. So then keep your eyes out. Look for this information. We'll put it out for you so you can reach out to them and reach out to Jackie so she can have an expert talk to you in your language and ask you all the right questions. And that way you can ask the right questions as well. How to protect your employees and your family. It is a great thing to do. Please don't overlook it. This health insurance is a big deal. You know that I know what you go through. Talk to me a little bit. We're almost over. What would be one good advice that you, Marie, will give in the small business owners to make sure that they stay in business, protect their employees? But when you do this type of things, you also show your employees you care for them.
Right. Yeah. I can tell you the healthcare benefits that we've provided again through Indigo Partners has been tremendous benefit for our employees. Not only does it help them and their families, but it helps us retain them, for when we need them to show up at work. So they're not waiting until, like your example, the lady at the restaurant, that you get so sick that they can't come into work for 2 weeks. So it's a mutual benefit.
Yeah.
For both
And
of
right
us,
now
yeah.
we're in so short staff.
Right.
That can be a problem if you have two of them sick at the same time. And for 2 weeks,
Yeah, with a small business, having one person out is a big deal for
Yes.
us. Yeah.
Yes, I can definitely understand that, and I see that in the community all the time. What are the time limits that we have here right now to sign up for these programs?
So for health insurance on the marketplace, open enrollment began November 1st. December 15th is the cutoff for a January 1st effective date. So in order to be covered in 2023, January 1st, that needs to be wrapped up by December 15th. However, there is an extension through January 15th that we can still get people covered up for February 1st. So unfortunately, you have to wait a whole year if you don't get that done. So for anyone that would qualify for a subsidy, we want to make sure as many people have health insurance as possible. And it has to be done now though, or otherwise you have to wait a whole other year. So we want to get this message out as soon as possible because the clock is ticking.
Bueno, como dice el dicho, no dejes lo que puedes hacer ahora para mañana. Hay que actuar lo más pronto posible. Tenemos 2 semanas más o menos para inscribirnos a estos programas de salud, porque si no lo hace, entonces usted pierde la oportunidad, se cierra la ventana y tiene que esperar hasta el próximo año. Y hay que hacerlo ahora, porque ahora es cuando la información está disponible, entonces usted tiene que hacerlo ahora. Busque información, existe la información, existe la ayuda, entonces hágalo. Es un seguro médico para usted, para sus empleados, su familia y para que proteja y así no tenga que estar usted enfermo todo el tiempo, trabajando enfermo. Evite eso. What is one good tip that you can maybe give in a small business owner?
I think the more you care about your employees, the more successful your business is going to be. And I think this is such an easy, affordable way to show you care about their health and well-being. And our goal is to help our community succeed and grow. And as small business owners ourselves, we know the struggles, we know that. And I just think this is an excellent way to help recruit new employees and retain the ones that you have.
Retaining employees is a big deal because when an employee sees that it's a benefit, there's a health insurance benefit or some kind of benefit to them, and they maybe make the same amount of money somewhere else, but they have this different here, they will stay with you.
It sets a business apart when they offer benefits.
Yeah, and right now, with the shortage on employees, it's a big deal.
And just another note, as differentiating from the health insurance, the healthcare telehealth benefits, they can be offered to 1099 contractors, part-time, no social security number is required, immigration status does not matter. It is very different than health insurance. So for those who maybe wouldn't qualify on the marketplace, these plans are an excellent resource. So for employers who maybe only have contractors, because we run across that, certain industries only have 1099 contractors, they may offer the Indigo plans, the telehealth plans, to any of those contractors or seasonal employees.
That is actually the most common things in the construction side. And as you know, most of our Hispanic community, they're on the construction side and the building side. And most of them, the people you see working in there, they're 1099s.
Correct. And they have, what's even more heartbreaking, not only do they not have health insurance, they don't have work comp either.
Yeah.
So if you have an employee, for instance, working in a moldy building for a week and they've become ill from the mold. I've personally am allergic to mold. I've been, it can make you extremely ill.
Yeah.
They don't have work comp, they don't have health insurance, they don't receive any benefit. They could at least call a teledoc, have nothing out of their pocket, yes, and have some healthcare access. So really my goal is to make sure our community, as many people as can be insured are insured, but for those who are uninsured that or underinsured, you know, with a high deductible, that they have access to something that they can immediately receive treatment if they need it.
And we have to act now.
Yes. We want to talk to you now. Now is the time.
Because it is the window, right? The window closes towards the middle of December.
Yes. And then you have a little bit of an extension till January 15th.
And then that's it.
But don't wait until like January 14th to call us.
Okay, well, I definitely enjoyed talking to both of you. It's been amazing, great information for the community. I cannot tell you enough how much. I hope that you stick around the community more and visit the places, the right places. I will definitely do my best to make enough noise for you, but I want to see more of you in the community, talking to the business owners and making this information available. Thank you for coming out and sharing about your company and the benefits that you're getting on your company. You had one more thing.
I have one more note. On the telehealth, those can be done anytime. Okay. Those can be done. There is no, the only time frame is for the marketplace open enrollment.
Yes.
Group health benefits, those can be started at any time as well. So if an employer does want to contribute towards health insurance for their employees, that's what would be called an employer-sponsored group health insurance plan. Those can be written anytime. We have people writing them for November 1st, December 1st, August, or any time you can start.
For the families.
But for the individuals on the marketplace, that open enrollment is currently
very good. Very
open.
Good information.
Yes.
Thank you very much for taking the time.
Thank you.
And,
Thank you for having us.
I hope that we get to see you more often.
Absolutely.
Yes. Well, muchas gracias a ustedes por estar poniendo atención a este programa y espero que lo compartan con las demás personas porque es una información muy buena. Estamos hablando de lo que es todo lo que tiene que ver con seguros médicos y la ventana se cierra para el 15 de diciembre. Si usted quiere comprar seguros para su familia, se cierra la ventana para el 15 de diciembre para que tenga seguro ya en enero 2023, durante todo el año 2023. Como las muchachas dijeron, también existe este tipo de seguro que se llama telehealth, que es algo, un doctor en el teléfono y lo tienen en español y es un programa que es básicamente gratis y es disponible para todas las personas aunque no tengan papeles, pero tiene que inscribirse en el programa, no es que así de pronto. Entonces ya saben, yo soy Carlos Vides aquí por Televida, Mentes Innovadoras. Nos vemos pronto.